Hello, I'm Dr. David Mosier, and I welcome you to the Cosmetic Surgery Center of Austin. All right, well, I see that you're here today to talk about possibly having a breast augmentation.
Yes.
So what I'd like to do is ask you a few questions, get an idea of what you're looking for,
Okay.
and then I'll explain to you how I go about doing a breast augmentation. I'll examine you and let you see a few photographs so you can get an idea as far as size and shape and what things should look like.
Perfect.
All right, so what size bra do you wear right now?
36C.
Okay, and what size do you think you'd like to be as far as cup size goes?
36D.
Okay, and do you have any problems with your breast? Have you ever had any breast masses or nipple discharge or anything like that? No? Okay. And any family history of breast cancer?
I'm adopted, so
Okay, all right. And how many children do you have?
2.
Okay, and do you feel like your breasts have drooped since pregnancy, or do you feel like your breast size is pretty close?
It's gone down a little bit.
Okay. Typically, people that have children usually have loss of volume in the upper portion of their breast. The breast doesn't necessarily droop down all the way, but you will lose a little volume up above. Is that what you're interested in possibly correcting?
Yes, more
Okay.
fullness.
All right, good. So the goal would be to give you a fuller, more natural breast as opposed to trying to look ostentatious and really large. Is that correct? Okay. And have you had a mammogram before?
Yes.
Okay, and what were the results of that?
Normal.
And how long ago was that?
A year.
Okay. Are your breasts fairly symmetrical?
Yes.
Okay. So any other specific questions or problems that you have about your breast that you want me to address today?
Whether or not maybe a lift would need to be done, or if just putting an implant in would give me that fullness that I'm looking for.
Okay, sure. The decision of whether or not to have a lift depends on how low your nipple is and how loose the skin is on your breast. We try not to do lifts if at all possible, because a lift will result in a scar that goes around the nipple, down the breast, and underneath. And I'm a plastic surgeon, so I close things up in a very fine line and try to make a very fine scar, but you will have a scar there. So we try to minimize the amount of scarring and give you the fullness and more natural look as best as possible. We'll look at that in a second.
Great.
Okay. All right. So are there any other medical problems I need to know about? You're otherwise healthy? You're not on any other medications or anything like that? And have you had surgery before?
Liposuction.
Okay. And how did you do under anesthesia from that?
It's a little slow to wake up, but
Okay.
they're fine.
And your scars, do you have any scars at all from that
They're so minimal.
Okay, good. All right, very good. As you've heard, there's various types of breast implants. Years ago, we put in implants that were like this, which were silicone liquid filled implants. So the bag was very thin and the material inside was a liquid silicone.
Okay.
What would happen is that the implants over time would dissolve or break, and then the liquid would leak out into the breast and cause scar tissue and hardening and sometimes a systemic allergic type reaction. So they took these off the market, and then we started using saline filled implants. Okay. Now the problem with saline implants, without the air, the problem with saline implants is that they feel like a bag of water.
Yeah.
Okay.
Not very natural.
So exactly. So these were safe because if the bag broke, then the liquid inside would leak out and your body would absorb it. But the problem is that they didn't feel natural. So now we use implants that are filled with a gel type silicone or gummy bear material. So the bag itself is slightly thicker, and the material inside, rather than being a liquid silicone, is a gummy bear material. So if this bag were to break, the material inside will bulge out, but it's not going to leak out into your body. If that happens, it's an easy procedure to replace the implant. It's about a 30-minute procedure.
Okay.
The chances of this implant rupturing is about 0.4% per year. Okay, so these implants that I use are guaranteed for life, so that for the first 10 years, the manufacturer will give you a new implant, plus pay about $3,500 towards the cost of surgery.
Okay.
If after that 10 years, they'll provide the implant for free. So, you know, the manufacturers that I use do stand behind their products, and it has not been a big issue with my patients as far as leakage goes in general.
Great.
Okay. So, do you want to feel
Yes.
that?
Yeah, that feels much better than that.
Yeah. Yeah. So there are different types of fill on these implants. They have implants that have a thinner gummy bear material and a thicker gummy bear material. The thickest one is most commonly used for patients that have had breast reconstruction. As the material gets thicker on the inside, it gets firmer and a little bit harder. So we have to, because there are 3 different types, we have to determine how much breast tissue you have on top of the implant to pad the implant.
Okay.
If you have a mastectomy and have no tissue, then you want an implant that doesn't ripple at all and that's a little firmer. If you have breast tissue, then you want an implant that is softer, and feels more natural, but may ripple a tiny bit more. Okay, and I'll discuss that when I examine you.
Okay.
Okay. All right. So, what are the risks of surgery? The risks are the same as any surgery: infection, bleeding, scarring, and the possibility that you might have to have another surgery for another issue. The chances of you having a major problem like infection or bleeding or something where I have to go back in right away is less than 1%. The chances of you having a minor complication, let's say I have to reposition an implant or fix a scar or something like that, is about 5%. So in general, most people are very happy and do very well with the surgery.
Great.
Okay. Any questions on how I do the surgery?
Is it under general anesthesia?
Okay, yeah, let me go over that. So the surgery takes approximately 1 hour to do and is done under general anesthesia, so you're asleep during the whole operation. Okay. I typically operate at Northwest Hills Surgical Hospital, which is downstairs from my office. We have board-certified anesthesiologists, and it's not like I'm doing it in my own office facility. You're doing it in an approved hospital in a nice facility.
Great.
Okay. The average person takes about a week off from work. Okay. Everybody's different. Some people take a few days. Some people take a week and a half. It just depends on what your pain tolerance is, because what hurts is the muscle being stretched.
Okay.
All right. But eventually, you know, initially the breast feels tight, and gradually over a period of 6 weeks it stretches out and the implants kind of fall into position. But the first week, most people take pain medication off and on. As far as medications go, the type of medications that we give typically are pain medication, like a narcotic like Percocet or Vicodin, Phenergan for nausea, because sometimes those medications can cause nausea, and the most importantly, muscle relaxants. Obviously the muscle's being stretched, so that you want the muscle to relax so the implant can kind of fall into position and you feel better.
Okay.
Okay? So about a week off work, 1 hour of surgery. At about 2 weeks, you can start fast walking. At about 3 weeks, you can begin walk, jog. In about 4 weeks, you can run. 6 weeks, no limits except your chest, because we want the muscle to stretch and the implants to kind of fall into position. So we really wait for chest exercises actually a few months.
Okay.
As far as bras go, initially you'll have a tube top on after surgery. That stays on for a couple days. And then we switch you into an underwire bra, which will hold the implants in place and allow the implants to fall into position. Sometimes we'll use a strap in the upper portion of the breast to push the implant down and to get it into its proper position. Okay? And then usually you're not having pain and feeling well after 2 months, and don't even realize that anything had happened except that you have pretty breasts.
Great.
Okay. All right. Did I answer your question about recuperation?
Yes.
Okay.
So no working out weight-wise for 6 weeks.
Yeah.
Okay.
So I typically tell my patients that you lift less than 5 pounds for the first week.
Okay.
Less than 10 pounds for the second week, less than 20 pounds for the third week, and at the fourth week you're pretty good, but you don't want to do push-ups and chest exercises that will contract the pectoralis muscle.
Okay.
Okay?
Doing chest exercises after your healing time, is that going to cause flattening of the implants if your chest muscle gets stronger?
That's a good question. Typically, the muscle goes across the upper portion of your breast. So if you contract the muscle, it tends to push the implants down and out. So you want to keep support to hold the implants in so that it doesn't push the implants out. And you don't want to thicken your muscle too much. So really, if you are going to do chest exercises, you want to hold the implant in and even stretch the muscle afterwards to keep it supple and thin.
Okay.
Okay? Hello, I'm Dr. David Mosier, and I welcome you to the Cosmetic Surgery Center of Austin. I've been in practice for 25 years, and I've dealt with all different types of patients. I tend to be a more conservative plastic surgeon in that I try to give people a more natural result. I personally take pride in my practice itself. My staff is great, and we really try our best to take care of patients in a very compassionate way. I try to be on time seeing my patients, and I'm very methodical, consistent, and technically accurate. And I feel that in the long run, patients value this and are very appreciative of taking the time to do a good job for them.